Sunny, and welcome to our Asthma Photovoice. For the last 2 years, Jakara movement has been running the Asthma Mitigation project in Sutter County. I've had the privilege of leading this project for over a year now. I've also had the honor of serving our Punjabi community, who have wholeheartedly invited me into their homes, parks, schools, and religious institutions. Being out in the field, I've come to realize that some of our most vulnerable communities in Sutter County include the elderly and immigrant farm workers, who are unfortunately exploited and have to deal with issues such as wage theft, unequal pay, poor living conditions, and then due to lack of knowledge and resources, community members continue living in these conditions regardless of the fact that it may actually exacerbate their asthma and afraid to utter a single word. Today we have some very special clients who will be sharing their experiences living with asthma through video clips and photos. Before we begin, I would like to thank all of our participants for their bravery and willingness to share their stories with us. It takes a lot of courage to open up about personal struggles, and we are grateful for the stories that they have shared. So let's get started.
I'm Matab. I'm in 8th grade, and I've had asthma since 1st grade, and it doesn't feel too good, and I can't really do too many activities like playing outside. I can't do much like that. And then the ways I manage my asthma is I keep my inhaler with me all the time, and that really helps a lot. And then my air purifier, I keep that in my room, and that helps a lot too. It takes away the coughing.
What makes your asthma worse? When is it the worst?
Probably dust.
Dust?
Yeah.
Dust, inside, outside?
Yeah, but the air purifier helps with that.
It does, okay.
Yeah.
How has asthma impacted your life, your everyday life?
I can't really go outside that much, but my inhaler helps with that though.
Your inhaler's been helping?
Yeah.
Yeah, and is this a rescue inhaler?
Yeah.
It is, okay. And we now know how to take our medication properly, correct?
Yeah.
All right, thank you. Hey, my name is Baljinder Kaur and my son's name is Mehtab Singh. My son has had asthma since he started primary school. He would have wheezing, shortness of breath, tightness in the chest, coughing, especially at night or early morning, difficulty breathing when playing outdoors. I took him to the pediatrician who diagnosed him with asthma and provided a nebulizer and quick relief inhaler that he uses throughout the day. I met Sunny with the Jakara Asthma Mitigation program at my son's dance class. She was doing outreach on asthma and took my information. Later, she called and did an intake interview, scheduled a home visit where she did a walkthrough and educated us on asthma as well as proper medication management. She also had our upholstery and carpets cleaned, provided my son with air purifiers and filters for the home. I had a roach infestation. Sunny provided us with a referral for pest management as well as gave us a box of 3M sticky pest traps. Since then, there has been a decrease in roaches and bugs. My son's asthma is much more controlled since and has no difficulty sleeping at night now. I would say he's 90% better than last fall. I'm glad these resources were available to help my son breathe better. Thank you, Sunny. Since I moved to the States in the 1970s, farming is all I've known and done. I've never held any other jobs and made a living out of farming. Asthma makes it difficult for me to breathe. As you see, I can't escape the pollution, pesticides, dirt, dust in the air. Face masks make it even more difficult for me to breathe. It's frustrating that even the simple act of being outdoors can be a struggle for me because of my asthma. Sunny helped me manage my asthma by providing me with the education I needed. She helped me understand my asthma triggers such as exposure to smoke, dirt, dust, pollen, or even brisk walking. Pesticides are chemicals that are designed to kill pests, but they can also cause respiratory problems. Exposure to pesticides can also cause an asthma attack, which can be life-threatening. I have to use my inhaler multiple times a day. Sometimes I feel like my inhaler is the only thing keeping me alive. There aren't many job opportunities for me here. Farming is all I know how to do.
name is Karen, and I wanted to mention a few things that I noticed while volunteering with Sunny in Yuba City for the Asthma Project. And the first thing I noticed in Yuba City was the access to healthcare. People in some communities may have less access to healthcare resources, including asthma specialists and medications, which can result in poorer asthma control and outcomes. And another thing I saw was the environmental factors. Certain communities may have higher levels of environmental pollutants or other asthma triggers, such as mold or dust mites, which can exacerbate asthma symptoms. Another one is socioeconomic status. People with lower incomes may have more difficulty affording asthma medications or managing other asthma related costs, such as home air filters or doctor visits. Another one was cultural factors. Such communities may have different cultural beliefs about asthma and its treatment, which may impact their willingness to seek medical care or follow prescribed treatments. The last one I noticed was language barrier. People who speak languages other than English may have difficulty accessing asthma education and resources, which can lead to poorer asthma control and outcomes. Man.
When factory plant combustion mixes in the air, it can cause a number of negative effects on people with asthma. This is because the smoke and particulate matter released by the combustion process can irritate and inflame the airways in the lungs, making it difficult to breathe. My name is Gurbinder Kaur, and I moved to the United States in 2015. I came to the United States with an asthma diagnosis. We initially settled in Fremont and then moved to Yuba City. I've been in and out of the hospitals for asthma and COPD, which is a lung disease. I met Sunny at the Ravidas Gurdwara in Yuba City. I informed her of my diagnosis. She came out and did a walkthrough on the different triggers within my home that were exacerbating my asthma, such as harsh chemical cleansers, mold in the kitchen and the bathroom, as well as the dirt and dust that was in our home. My husband and I are farm workers, bringing in dirt and dust on our clothes into our homes every single day. Sunny was able to clean our upholstered couches and carpets, provided us with fans, air purifiers, filters, vacuums, mattresses, pillow and mattress protectors, even couch covers that were washable. I have difficulty operating my Avlo Vest airway clearance system jacket. Sometimes I accidentally reset the settings. Sunny is a lifesaver and gets it working again every time. Thank you, Sunny. After hearing from our participants, it's clear that living with asthma is a significant challenge that requires a multifaceted approach to manage symptoms and improve quality of life. This includes education, environmental action, and emotional support. To truly make progress in this area, we need policymakers to prioritize asthma management by allocating more resources and funding towards research, education, and treatment options. By working together and investing in the well-being of those living with asthma, we can create a world where everyone can breathe easy. It's time to take action and make asthma management a priority. Thank you.